Bismillahirrahmanirrahim. Assalamu alaikum. Today I am here to talk about the importance of pulse wave Doppler in the fetal echocardiography. Pulse wave Doppler has an importance in assessing during the fetal circulation. Pulse wave Doppler can be used across the AV and BA valve as well as across the pulmonary veins and the SVC or IVC. Here on the board, number one is the pulse wave on the mitral valve. First, when the Doppler sample gate is placed at the mitral valve, then we get the trace here shown in the diagram. Here the E is smaller than A during the gestational period. E shows the early diastolic filling and A shows the late diastolic filling. This become reverse after the birth, or this is the normal biphasic flow throughout the gestational age. Sometimes it may reverse at the end or near to the delivery. This is four chamber view and we use pulse wave Doppler across AV valve. This is left AV valve, you can see on the screen. By putting the pulse wave Doppler across mitral valve, we have a trace E and A. This is biphasic flow pattern which is normal, and E is small here you can see, and A is tall during the gestational period, and this is normal. Similar is the case with the pulse wave Doppler when placed at the tricuspid valve. We get the same EA variation, same as E is smaller than A. Likewise, across the tricuspid valve, we can also see the similar pattern E small and A greater in the early gestational age, although it reverses with the passage of time and with the advancement of the gestational period at the end, but at this moment this is normal. And E is the early filling, which is quite separate and clear from that of the A wave. If there is merging of E and A, then it will an indication of structural and functional lesion in fetal heart. Now move toward the pulse wave Doppler on LVOT. This means that we place the Doppler gate just distal to the aortic valve and get used to assess the or measure the systolic velocity here, and we get the Cloyer-Click line of the aortic valve. This also shows or indicate that we place the pulse wave Doppler at the right place. And the velocity which is shown here is reaches to the 80 centimeter per second or less than 100 centimeter maybe, or sometime it may exceed to 110 in the early gestational age. Here we place the pulse wave Doppler at the just beyond the aortic valve, or we get the trace through pulse wave Doppler on the screen. On this is the acceleration through aortic valve, and this is the Cloyer line or Cloyer click, which also shows or confirm that we have taken the trace at the exact level, and the velocity shown during the gestational age is 80 to 100. Less than 100 is normal, or sometime it exceed from 100 to 110 during the early gestation age. That is also normal. Similar to that of the LVOT, we also place the pulse wave Doppler uh, at the just distal to the RVOT or the pulmonary valve. We get the sharp acceleration and having a little notch, and we get also the Cloyer-Click line. This is also the representation that when we have placed at the pulmonary valve. When we move toward place the pulse wave Doppler at the ductal level, then this clear line disappears. Here, the velocity also more or less similar to that of the
Here we
aortic
place the pulse wave Doppler just beyond the pulmonary valve, and we get the trace through PW. This is the sharp acceleration of the pulmonary jet with the upstroke having little notch, and this is the clear pulmonary valve closure click. This also represent that we have placed the pulse wave Doppler at the right place, and the gradient should during the gestation age is 50 centimeter per second. That is normal in this period.
valve. Now move toward the pulse wave Doppler at the pulmonary veins. Then we get this trace here in which we have the phasic flow, which shows that first of all is the ventricular systole, then comes ventricular diastole, and then the atrial contraction, which reaches to its lowest velocity. This is normal phasic flow during the gestational age, but it may be reversed in case of the hypoplastic heart. That this phasic flow may be reversed.
Here we place the PW in the pulmonary vein to assess the flow in the veins coming to the LA. The trace we get shown on the in the fig, this represents the ventricular systole and this represents the ventricular diastole. Here the atrial kick or contraction, and then it the velocity becomes at its lowest point, and this pattern may be reversed in case of the hypoplastic heart, or we should see the flow or confluence between the LA and the pulmonary veins. Pulmonary veins or there is descending aorta gap should be seen or assessed well on the fetal echocardiography in order to exclude the anomalous pulmonary venous
Now move
drainage.
toward the bicable view, in which we see that the SVC moving, draining into RA, and IVC moving also from the liver move toward or draining into the RA. In bicable view from the color Doppler, we can assess that their symmetry. If there is disproportion, then we think about the TAPVR or TAPVC, either in, supracardiac or the infracardiac, due to the generous flow in the SVC or IVC as well. So this is the end of the session in which we have talked about the pulse wave Doppler across the AV and VA valve. Inshallah, I'll come with my next session or with next new information in the next session.